Or if anybody needs or wants to share this with somebody else later on, this should be uploaded to our YouTube channel and our website within like the next 48, 72 hours. The other thing that you may notice is you are muted and you are off camera. So just sit back and relax. And Janie, I'll have you take it from here.
Well, I want to thank everybody that's joining us today and taking your time out your day to learn about the ALS registry. Um, I heard about my registry from my ALS doctor when I got my actual diagnosis. And as you know, um, it's a very overwhelming time for you when you're diagnosed. And, you know, at that appointment, he had told me, oh, make sure you register. And so luckily, my husband kept reminding me because obviously it wasn't on my forefront of my brain to register right away. So my husband gave me gentle reminders. So um, if could do a family member or friend that might have been diagnosed to just ask if they've registered, because it's not mandated by the state of Illinois and many other states, which Reshma will talk about. Um, do you want to go with Reshma or should I keep going?
Rishma, can you hear us? Is audio working?
Yes, I can hear you. Can you hear me?
Yes.
Oh, perfect.
So, only thing you missed is we started recording. I did brief introduction, so welcome. And then I had Jeannie, she literally was just talking about kind of her experience with her doctor after being diagnosed, telling her about the registry and how to sign up, and her husband kind of being that good reminder of like, have you done this yet? So I don't know, Janie, do you have anything else you want to say just yet, or do you want to put a pin in that and we can kick it over to Reshma?
Is it okay if I just continue and then go from
Yeah,
there? Okay, just because my brain's a little off and I just want to make sure I get through this.
yeah,
Thank
that's great.
you. First of all, why is it important? I kind of touched on it that we have to self-register, which is important. We want our voices heard. We want to know, what is the common link to the cause because we're all trying to figure that out, right? Um, so it also gives us hope, you know, by them collecting this information and hopefully finding a link. You can also learn about clinical trials, which I know Reshma will probably continue to talk about. But if you're like me and you no longer are a person that can participate because you've been diagnosed um, too long, it's been too long since your diagnosis or your initial onset of symptoms, um, you may want to be able to participate in other type of like clinical trials that are like more or less it could be your speech, it could be if you're still able to walk, to do some walking tests, things like that. um, and sometimes the clinical trials may not be near you, so this is a good way of being notified if you sign up for notifications that you can still participate in different types of clinical trials that are not medication wise, but other different forms of trials. Um, Once you register, you can obviously opt in to receive the alerts through your email address. The important part, I feel is really important, is completing the risk factor surveys. Um, I feel like they're very important. There used to be a ton of them before on there, and they've kind of streamlined them. But the beauty of doing the surveys, if you're not up to finishing one that you started, it'll save where you finished off. And when you log back in, then you can continue from where you left off. So that's actually really nice. Some of my tips and tricks is to schedule, put it on your calendar, an allotted amount of time for you to register. After registering, to fill out the surveys. And then you can get help, from a partner or family member or anyone that's, able to help you. They can't do it for you, but they can help you input the information if you need to. That kind of helped me. I still have a couple surveys to go, so I put them on my calendar as a reminder. So hopefully that'll help you. So those tips and tricks. And it just remember you need your voice to be counted. And this is a way to get it counted, as well as other ways, which I'll have Reshma continue. Tab 14.
Janie, thank you so much. And let's see. Reshma, are you able to share your screen?
Yes, let me
Perfect.
try to share. Okay, can everyone see my screen?
Yes, fantastic.
Okay, let me put it in. Here we go. All right, you all can still see my screen?
Yep,
Perfect.
this looks great.
All right. Well, thank you everyone for being on. I apologize for the audio issues. We've been having some connection issues on our end. And thank you, Janie, for your insight. And as always, we love to have you provide your, peer-to-peer perspective. And I think it works well with the talk that I'm going to give today. So, like Anne said, my name is Reshma Punjani, and today I'm going to present on the National ALS Registry. Here are just a couple of disclosures. So I want to start off by talking about why the National ALS Registry is important and why patients should join. So the National ALS Registry is a program that collects, manages, and analyzes data about those living with ALS. So as some of you may know, ALS is not a reportable disease in the United States. So what that means is there are some diseases that are reportable and that there are some that are not reportable. Those that are reportable are reported from your doctor all the way up to the county health department, state, and then to the national. Because ALS is not reportable, it's hard to get a gauge of how many people are living with this disease in the United States. So this is where the registry comes in. The registry allows those who are living with ALS to fight back and help defeat the disease. So some of the goals of the registry are first to seek to find out what is causing ALS. We also are looking to see what are some of the risk factors. And like Janie mentioned, there are multiple risk factor surveys that we have that you can complete, and that helps us understand what could be potential ALS risk factors. We also report on the number of ALS cases in the United States. So that's incidence and prevalence in attempts to identify every person living with ALS in the US. So here's some history on the National ALS Registry. So in 2008, there was a congressional mandate for the Public Act Law 110-373, which made the Centers for Disease Control launch the ALS Registry in 2010. And once the National ALS Registry was launched, we had a web portal system, which is what the registry is. This is a voluntary system, and this also includes the risk factor surveys. So it's a two-part. The first part is to enroll, is to be counted as a case. Once you sign up, you have your login information, and you can come in and do the surveys at your own time. You could do one at a time. You can come in and put aside some time and decide that you're going to divide up these surveys however you would like to do it. But once you've signed up, the surveys are open to you. So then in 2013, we also launched the National ALS Biorepository. And the biorepository is a way for those living with ALS to contribute biospecimens to ALS research. This is also voluntary, it's not required. You can choose to be a part of the registry and not participate in the biorepository as well. So here is a sort of infographic that I like to use to kind of show all the different components of the National ALS Registry. So once you sign up, I like to think of it as, a door opens up. There are multiple things that are open to you once you are part of the registry. So first, when you sign up, you're counted as an ALS case. Second, you're able to contribute to the biorepository, which is at this top section right here. Your data, it contributes to the epidemiology and what is known about this disease. So we also, while we were doing research internally, we also make this data available externally to researchers. Researchers can come to us and request data, and we provide that data to them. And all of this furthers ALS research in this field. There's also a research notification mechanism where if there is a researcher that is recruiting for a clinical trial or for a research study, they can come to the registry and provide their enrollment information. And the registry, if you have chosen to be notified of these alerts, the registry sends out these notifications to everyone that's enrolled. And so this allows you to connect directly to researchers that are doing clinical trials or research studies. The survey data is also a great way to contribute to this field. So there are 18 risk factor surveys, and I'm going to go through a couple of the topics in the next few slides. But if you see the number of surveys, there are multiple areas where your feedback is appreciated. Whether it's what area you grew up in, did you play sports, different things like that that help kind of piece together the puzzle of ALS. And we also have the partners. So when you join the registry, you have all of the resources available. You are able to connect to our partners. For example, the Les Turner ALS Foundation is one of our main partners. We work with multiple partners across the US, and you can see many resources through your registry portal. So here's also another infographic that just really shows how the National ALS Registry is a multifaceted platform. So here you can see there's patients, clinicians, and researchers. So for patients, when a patient enrolls, they're able to be counted. They're able to be linked to research as well as other clinicians and researchers that are doing studies and clinical trials. And you're also informed. Every time there is a new research study, there is a new publication, we always make sure to put that on the registry dashboard. The dashboard also has information on what the incidence and prevalence is looking like. How many new cases of ALS are being diagnosed every year. Going over to the clinician side, we're able to bridge, communicate, and provide those resources from a clinician standpoint. And for researchers, we offer the recruitment assistance as well as providing assistance with data requests, grants, and other additional resources. So here is the slide that I was referencing about the risk factor surveys. So why take these risk factor surveys? First is it helps our researchers find clues about ALS. So here on this screen, you can see multiple areas that the risk factor surveys target. The first one is your occupation. It's looking at are certain occupations at a higher risk for ALS. There's also a survey on military service. Why are veterans at a greater risk for getting ALS? This is a big area of research, and when you complete the risk factor surveys, you're able to provide your personal input into this, which is used by researchers on a larger level. We also look at physical activity, smoking and drinking. Are these certain risk factors linked to ALS? There's also a survey that looks at residential history and residential pesticide use. There's another one that looks at traumatic brain injuries. Did you have a concussion growing up? Did you have any sort of brain injuries? Could that be something that might have been a risk factor for your ALS? And there's also one that looks at your disease progression. How fast or slow is your disease progressing? And lastly, there is an open-ended question, which is your patient perspective on the disease. And this survey allows you to provide your input on what you think could have been certain risk factors that you believe might have led to an ALS diagnosis. And like it was mentioned earlier, you can take these surveys in any order. Caregiver help is always appreciated. We've heard from many patients that they use this as a time to connect with their families. I had one individual say that, they sit down with their grandkids and fill out these surveys. And in that, they're able to learn more about their grandfather. And, oh, I didn't know that you played this sport growing up, or I didn't know you lived in this state. And it ends up being a two-prong approach where you get to know about your grandparent and it brings a family together, and you're also contributing to the ALS research. And all of these surveys at the end really help us solve the mysteries behind ALS. So here are some of the surveys. Like I mentioned, you're able to take them in any order. The caregiver help is always appreciated, and you're always able to complete a few and come back. There is no pressure to complete, all of them in one sitting. I understand some of them are longer. Sometimes we may have to even, dig through the memory or through the files to figure out what was the residential history, and some of the more in-depth questions. Feel free to always come back. You can save your progress and you'll be able to see it all on the dashboard. Now let's talk a little bit about the National ALS Biorepository. So our biorepository is significantly different from others in the sense that the risk factor survey data that I just referenced is linked with the biosamples. So when you enroll in the National ALS Registry, you have a couple of options that are available. You enroll, you can complete the risk factor surveys, and then you can also donate your biosamples. When one individual does all three, it becomes a more complete data set. So when that researchers are requesting this information from us at the registry, we're able to show risk factor data along with biosamples, and that makes it an even better, data set. The National Biorepository is also nationally representative, and so that it expands beyond referral centers. We've also tried to make it user-friendly to those living with ALS. That is, the phlebotomist will come to your home to collect the samples. These biospecimens are collected specifically for the biorepository, so we do not use any leftover study samples. We don't donate ours to other biorepositories, and we do not accept, others into ours. And the pre and post-mortem samples are kept in one central biorepository. There's also no charge for patients. We want to make this as user-friendly as possible. So like I mentioned, the phlebotomist comes to your home, and all of the processes are done free of charge. And this is also the largest collection of pristine ALS samples for research. So here is the National ALS Registry website. And I've included a screenshot. I know the font is a little bit small, but I wanted to show what it looks like when you go to the website. So here is our website. It is www.cdc.gov/ALS. When you log in, when you come to the website, this is what you'll be seeing. So here, if you click the join button, you can log in and create a new account. Here you can always come back in to log into your dashboard. And here is where you can go into your account. You can complete the risk factor surveys that you may have left off. This is where you would access your account. Here below the National ALS Registry dashboard, when you click here, you're able to see the ALS data. So you're able to see the incidence numbers. You're able to see what the new publications are showing. So I like to point this out because for those who are interested in the research aspect, you can always find the most up-to-date data from the registry in this section. And below, you'll also see a place where you can see the active clinical trial studies. For those that are open to recruitment, you can always click here and see if you are eligible for those clinical trials, and you can be contacted directly through here. Again, our website has several resources. This is just the first screen grab of what you'll see, but if you go down further, there's more resources for patients, for researchers. You can learn more about the ALS Biorepository on this link right here. You can also see the publications and the reports that have come out. So not only the reports that we have published from the registry, but also publications that have come out using data from the National ALS Registry. Below, you can also sign up to be included in our newsletter. And you can do this when you sign up for your account, and you can also do this here. And then there's more information on our annual meetings, what conferences we'll be at, and some FAQs as well. So I like to point this out because our website has, a plethora of just resources, and we want to make it as easy as possible to connect with those living with ALS. So just some, last statements on the impact of the National ALS Registry. So like I mentioned, we maintain the largest database of ALS patients in the United States. We also partner with ALS organizations. Like I mentioned, the Les Turner ALS Foundation is one of our partners. We have other partners across the US that help us connect to those living with ALS. We're also advancing ALS research through the National ALS Biorepository, through collecting biospecimens. We also collaborate with research institutions, pharmaceutical companies, academia to provide that recruitment assistance I mentioned earlier that connects those living with ALS to clinical trials and epidemiological studies. And we also provide the updated national epidemiological estimates of ALS cases in the United States. And so that is one thing every year we provide reports on what ALS incidence and prevalence is looking like, as well as data across the nation. So that is the end of my presentation. I can open it up for any comments or questions that you may have.
Reshma. Oh, my goodness. We must have like a little elf creating some mischief today. Um, Reshma, thank you so much for all of that wonderful information. We did have one question come through that I think would be really, really great to bring to both you and Janie. So this person is talking about how with ALS, it can take a long time to actually get diagnosed. So, with that delayed diagnosis or sometimes misdiagnosis that eventually does get corrected and is ALS, how does that affect the registry, or does it?
So to be a part of the National ALS Registry, you do need an ALS diagnosis. And I completely hear the struggles of even getting that diagnosis. I've interacted with several people that are living with this disease and have heard that, it's sometimes almost eliminated, and that's kind of the last diagnosis. And so I completely understand how tough that could be. But to enroll in the registry, you must have received a diagnosis and you also have to include your diagnosis date. So to be part of the registry. But of course, for resources to be connected to the registry, please feel free to connect with us if you are in those kind of middle stages. But to be counted as an ALS case, you must have a diagnosis.
And does a delayed diagnosis, like it does sound like you are capturing the diagnosis date and possibly even symptom like onset. So is that
Mhm.
something you guys are also studying to be able
Yes.
to get kind of a better picture?
Yes, yes. So that is also one of the questions that are part of the surveys is what was your symptom onset? Because a lot of times your symptom onset and your date of diagnosis can be completely different dates. And so we want to know that. We want to know what was the first symptom you experienced? What date was that? When was your diagnosis date? That way we can kind of get a better understanding of if there is this delay or what the discrepancy is between the two dates sometimes.
Yeah. Oh, and so important. And is there any like cutoff time? So maybe I was diagnosed a couple years ago. I haven't gotten around to it. Is it still okay to join the registry?
Oh yes, there is no cutoff time. Whenever you hear about the registry is a great time to join. Your diagnosis date doesn't matter whether it was recently or whether it was a few years ago. We would be happy to have everyone living with this disease kind of join, be counted, and be able to contribute to that research as well.
Awesome. That's great to know. Um, Another question you mentioned about how you can connect with researchers. Um, any tips for if there are any like researchers on the call that are maybe looking for a point of contact or are looking for maybe some data that they could study? How should they go about that?
So if you're a researcher that is looking for data, you can contact us directly. You can always contact myself. Paul Meta is the PI of the registry. All of our information is found online. Our email address is there where someone can contact you about the data that you're requesting as well.
Awesome. And then building off of that, someone had a question about AI and when you're making the data available to researchers, do you know if artificial intelligence is being used to kind of extrapolate data or to further look at maybe some trends?
So to my knowledge, not that I know this far. That's not saying, a researcher could not come to us with a request saying they want to build out a model, using AI. But of course, when that comes, we'll have to, of course, see how it works with our clearance internally. And, there is a review process as well for data because, of course, one other thing I wanted to bring up that I might not have mentioned during the presentation is all of the data is de-identified. So we want to make sure that, for anyone that is on the call that may have that concern for privacy, for your data. When we get the data in-house, we de-identify it. There is no identifying, no birthday, no information that could link back to the individual. So they get their own number within the data set, and we want to keep it as secure and as private as possible. So even in the long term, if AI is something that comes down the road, of course, that would have to be addressed, internally, how to make sure we further protect the data. But that is one thing. Currently, any researchers that get data from the registry, it is de-identified. And even what we publish on is only published on a state or larger area. We don't publish on anything citywide or, to the granular level because we also have various OMB and IRB clearances, and we want to make sure that we're protecting the patient data as well.
Oh, that makes me feel so good. That was going to be kind of my next question. If people were on the call and worried about, security or who has access or,
Mhm.
all of that. Janie, I have a question for you. So I'll give you a second to unmute, but um, you had given some great tips about like, oh, add a reminder on your calendar that you want to add this or you want to complete this survey. Do you have any notes on how long it took you to fill out like that initial survey or anything that you found helpful in order to get through some of those surveys?
Sorry about that.
No,
Um,
take your time.
no, I was diagnosed in 2021 of December, so I probably didn't fill it out. The initial registration, probably June of 2022. Um, I know it was like it. I was thinking like, oh boy, I should have had all like my dates and information in front of me just to make it a little bit easier instead of me being like tracking it down while doing it. So that might be helpful. I don't, it did bring back a lot of like, you had to think about things because, it did ask about your different residents, where did you live, um, like your sports and things like that. Um, I was a ballerina and I danced like 6 out of 7 days a week. So, that makes me often think like, does it's considered not really a sport, but it is, type of thing. And so I don't know if that contributed or is it environmental. And that's where we're trying to get these answers by doing these surveys. So that's why it's really important that, we do take the time and, have them filled out. Um, but I don't, I think just the initial diagnosis is very overwhelming. So, when you get to this um, point where you're filling it out, um, I think it does kind of bring up, you got to think about all these things. So that's why it's important to have like dates and things in front of you.
Yeah, that's a really great point. I think another question that came to mind was, what about like the emotional load of being able to fill out the registry? As you kind of mentioned, like, oh, you know, hindsight is 2020. Have your dates or like somebody with you when you're filling it out just to kind of work through like, oh wait, was it that day or this? Instead of like sitting down, starting to do it, and then, oh, can you go grab, that file that's in the library or in the other room? So making sure you have all of that with you. But how do you any tips on just like how to take care of yourself when you're filling these surveys out? Um, when it may bring up some kind of emotional piece on your diagnosis. You stated really well, like the diagnosis itself is overwhelming. So then now we're being asked to like fill in all of this information about maybe what could have possibly contributed to your diagnosis. So, any advice on that?
I think it was a good emotional piece
Good.
to kind of make you like think about it and um I don't know, it to me it kind of makes you feel like you're contributing and maybe you're thinking through these things where, at the time, your brain is on overload in your heart, right? When you get your initial diagnosis. Well, when you're filling this out, I feel like it's a good, I don't want to say like closure, but, it gives you that peace that you kind of think through it, get it on paper, that kind of thing. And that's why, like, my family and I often try to think like, what could have it been, since I'm not a gene carrier or I didn't receive the gene. So, I'm a sporadic patient with ALS. And so, you're always like questioning what could it be? So it kind of makes you go through your life history, kind of think about it. And I think it's more, I don't know, emotional healing to me, I felt. So I hope that that does that for somebody else as well.
And I think Janie, you and Reshma had mentioned you don't have to complete all of this in one sitting. There's that nice save feature so you can kind of come back to it, take a break, come back when you're refreshed. Like, should you start to feel overwhelmed by just the amount of information and the questions being asked?
You're tired, because
Yeah.
feel less, we do exert more energy. And, if you're just, tired, need to take a nap, you can do that because it saves your information as as you're going forward. I know a lot of people ask, um, how do they know if they did register and make that? So I don't know if Reshma wants to speak to that and what they can do to check.
That's a great question.
That's a great point to bring up. So a lot of times people do get confused, when they hear about the registry, they think they may have signed up, and sometimes there are a lot of things to keep track of. You can always go to the registry website, like I pointed out, and you can try the forgot password component. You can put in your email and see if that works. If it doesn't, then we also have a great phone number available. We have someone on staff. Essie is always available to, kind of look up if you do have an account, if it's better to do it through phone or through email as well. But if you don't have an account, you can always just create a new one, put in your information, and it will carry you into the next page.
Oh, that's great. And just to kind of further clarify that, so I would have to put that information in. So it's not like I got my diagnosis from my ALS care team and the doctor will take care of it.
Yes, that is this is a patient enrolled registry. So while you can of course have anyone help, whether it's a family member, if it is a team member you're working with, but it has to be through the patient. The patient has to enroll in the registry and be counted. So the doctors will not register you. Like I even said, ALS is not a reportable disease. So there we don't have that direct connection with the doctors. So the way we do capture how ALS is across the United States is through this web portal where people can register and be counted.
And it sounds like there's a lot of avenues for additional support. So, Janie, you had mentioned like I had my husband and my family help me fill these out. Reshma, you mentioned that if you need additional assistance, there's somebody available either by email or by phone that can help you. And then I know at the Les Turner ALS Foundation, we have a dedicated staff person. Her name is Kara Gallagher, and she can help anybody get connected and fill out the registries. Um, is that correct? Like that's kind of the nice safety net. You don't have to do this on your own. There are multiple ways to get assistance to complete the registry. Reshma, what about other states that may have um, we have some other good questions coming in. What about other states that have a state registry? Does the National ALS Registry, like for example, I think Massachusetts has its own
Mhm.
state registry. Do you communicate with them, or if I filled it out in for the Massachusetts state registry, do I also have to join the National ALS Registry?
Yes.
Okay.
So the National ALS Registry is for the entire United States. So for Massachusetts, Massachusetts does have its own state registry, but those who sign up with Massachusetts are not funneled into the National ALS Registry. Interestingly enough, though, we did do a comparison paper. We did compare the data from Massachusetts and the National ALS Registry. If anyone's interested, that paper is up on our website just to see, how what the difference is between the two. But again, for being a part of the registry, the only way to be a part of it is when you enroll. So if you want to be counted for the registry, you have to enroll. Unfortunately, it's not going to come from the doctor. It's not going to funnel in from any state ones. But it's just the patient enrolled one-on-one.
Okay. Um, and then somebody had a question about completion of all the surveys. Do I have to complete all of them, or can I just complete some of them?
You can complete as many as you would like. We would, of course, appreciate if you could complete all of them, just so it gives us the biggest, picture that we could have of an ALS diagnosis and different risk factors associated with it. But of course, we appreciate any time that you can give. So if you want to do a few and come back to it, like Janie said, put it in the calendar for maybe even a few months from now. progress is better. But of course, if you can only do a few, I encourage that. I encourage you to get enrolled. And when you do sign up, this might have been mentioned on the call, but I want to highlight it again. There are places where you can check mark the box to say you would like further emails from the registry. And it's very important when you do enroll to click that box because that is how you're going to hear about the clinical trials. That is how you may get, signed up for our newsletter. And any emails that come out through the registry, the only way we can send those is if you have, ticked off that mark, that box in registration. And if you haven't, if you've already enrolled and at that time you may not have, you can always go back to your profile and reselect that box. So just want to put that out there. If you sign up and you say, why am I not hearing from the registry? They said they always send out, new things, and it could be because you never check the box on the sign up page.
I also want to ask, like, when you do the surveys, you don't have to do them in order. You can pick your ones that you want to do
Mhm.
on your, like I picked the ones that I felt like were more interesting or pertinent to me. And then, you don't have to feel like you got to do them in order.
Um, Another question about some of the surveys. You mentioned there are surveys on like traumatic brain injuries and alcohol or smoking use or where you lived. Somebody's wondering if there's a survey on like your vaccination status or the vaccines that you've had.
I do not recall if there's a specific question. I know there are questions on maybe other diagnoses that you've received, but I'm not exactly sure. That would be something I would have to get back to you on specific vaccines because that is more of a recent thing as well, especially
Yeah,
for the whole vaccine thing.
yeah. And I suppose, I think you had mentioned that there's a place where you can just like free text, like more information
Yeah.
about yourself or about your kind of medical journey. So that in theory could be a spot where you want to capture, um, you know, vaccinations or not, you know,
Yep. Anything you
not
feel that might have been missed,
pursuing
if you
them.
go through all of the surveys and you think, oh, well, I really believe that X risk factor might have been what caused it. Put that in, there's researchers looking at the responses from just that survey because they're trying to dig deeper. There's risk factors that we know a lot of times, veteran status, environmental exposures, but there could also be some unknown risk factors that through people completing the surveys, if there's enough that come up, that could be something that researchers kind of delve more deeper into. So yeah, please feel free to, put whatever input in that. Of course, all of your information is very secure. Just want to reemphasize
Yeah.
that. But if there's something that you feel wasn't brought up during the surveys, you could always include it in that section.
Another question that just came in was, do you know of any opportunities research-wise for folks who maybe haven't qualified for clinical trials, given that they were diagnosed like outside that time frame of like, the first 12 to 14 months of a diagnosis? Do you know of any changes to that?
Not in terms of the criteria for clinical trial studies, but if you are, curious to see if you are eligible, that link that I pointed out on our main page, you can click that and see what current studies are being recruited for. And again, if you have any additional questions and you want to, be connected, you can always email us and we can help you one-on-one as well. But that link always has the most up-to-date clinical trials that are being recruited for through the registry.
Yeah. And are there any biomarkers that maybe the CDC is looking into for increasing diagnostic timeframes or having a future of like a diagnostic test that can, speed up diagnostic, certainty in the disease?
So I think a lot of the researchers that we collaborate with have been looking at these sort of things. And that's why I also pointed out that the publications section, you'll be able to see all of the new research. So anything, even if it's not something that we've researched on, if it's something that is using registry data, if it's one of our partner researchers, we always like to post that because for example, in terms of biomarker research or in any other capacity as well, that's all available. And I know a lot of times uh, researchers or even those living with ALS are keen to know the new information that's out there. And so anytime a new publication is even brought up, we also send it out on an email as well. So that's why it's important to be linked to us through email and also follow, our partners. I know a lot of times our partner organizations will put it on social media anytime there's a new publication. And so, yeah, we are always working with internal and external researchers on those sort of topics.
And if you're also interested in another resource for clinical trials, ALS TDI has a great trial navigator. So for somebody who maybe is, diagnosed at a different time and you want to kind of figure out what you may be eligible for, that can be another great resource. We also have um, a great, you know, uh, link on our website that can also help link you to other studies. So I'll drop that in the chat as well. And then lastly, kind of thinking about that, Janie, I know you just have experience being a research ambassador through Niels. Um, and I know that you are on some patient advisory boards or have been. So also trust that Janie is fighting the good fight for, getting those researchers to maybe expand the population that they're looking to research.
I want to mention everything ALS is also doing a study. So if you're interested in participating in a speech study as well, that's important, as well as the Radcliffe study, which is speech combined with like walking, gait, and that type of thing. So that's important. The ALS TDI, obviously you had mentioned, and ALS Gov
Mhm.
is also very good resources to look for clinical trials.
And then lastly, someone mentioned here again about those dates of symptom onset and how important those can be. Reshma, you had mentioned that there is a section to put in that in the registry, but is that a potential area of research for the CDC?
So yes, because it's included, that's a great data point that's available. So whether we're looking at it internally, I know researchers externally are also looking at symptom onset, diagnosis date, and disease progression too. If you recall, one of the surveys is about disease progression. I think that's a great one because it allows us to see, some cases of ALS progress quicker than others, and some have a slower progression. And it's great to be able to kind of use that information along with other risk factor information that is available through those surveys to kind of see does a certain risk factor, slow down the disease progression? Is there any sort of correlation in them? And so yeah, that all is when you log in and you start going through them, you'll see a lot of these questions and how they can kind of help piece together that puzzle of ALS.
Fantastic. Oh, one last question. I was just about to wrap up. Is the registry for US residents only?
Yes. So the registry is for US residents only at this time.
Okay. And what about US territories? So, like if somebody is from Puerto Rico,
Yes. For all US citizens, it's for all US territories. Yep, yep. But it's only within the United States.
only within the United States. Okay. And if you are from another country and you're interested, um, I may suggest you look into whether or not your country has a registry or the continent that you're on. I think Europe is starting to capture some similar data. So Googling your country's ALS foundation or looking into the International Alliance of ALS MND associations, that could be a really great resource. All right. Oh, okay. Promise, one last question. If you submit your biofluid samples from the All ALS Assess study, will the CDC have access to them for future studies?
No,
No.
it has to be through the registry. Like I mentioned, we don't get any leftover samples, and so whatever samples there are, it's those that are collected through the registry. So if you're interested in, donating biospecimens, you can just sign up, and there's another area where you can mark off that you're interested in the biorepository, and that will come up. And we have a great biorepository coordinator who will reach out to you and we'll make the process as seamless as possible, and it's available at your time in the comfort of your own home.
Oh, that's so fantastic, especially with all these appointments that people need to make and
Exactly.
places they need to get to. It's just one less thing to worry about.
Mhm.
Fantastic. Well, Reshma and Jamie, thank you so much for your time today. We really appreciate it. We have another ALS learning series that's coming up towards the end of the month. You can register for it on our website at lestturnerals.org. It's going to be covering constipation and bowel management in ALS. So we look forward to seeing you then. In the meantime, again, thank you all for your time and attention today and your great participation. And we will see you in a couple weeks. Reshma, Janie, thank you so much. Have a great rest of your day.
Thank you.